Welcome to mychronicpain.com's blog. Today's video blog is a response to several questions we've been getting on narcotics. The question is, what are the side effects of narcotics or opiates and how to deal with them? We were very surprised to see this question because in the past most pain clinics or doctors who have experienced prescribing narcotics that we've worked with have given a handout on the narcotic side effects, and they've included their standing orders or what they do for these side effects and how to get the medication by calling in or calling the pharmacy. So we knew that we either had some new listeners or some new people contacting us, or we knew that there's a new group of physicians that aren't able to do that, maybe because of time constraints or whatever. But we're going to go ahead and review it. Now remember, narcotics are opiates. They're serious medicines. They can lead to dependence, addiction, mood changes. They can be overdosed. If your doctor is prescribing them, then your doctor needs to know if you're having side effects. So get a hold of your doctor, get a hold of your pharmacist, get a hold of your pain care team if you're on narcotics and have side effects. Now, keeping that in mind, let's go over the big five. The big five in side effects are constipation, nausea, sexual problems, itching, and sedation. That's constipation, nausea, sexual problems, itching, and sedation. Constipation. Let's talk about it. Constipation can usually be prevented by drinking enough water, 6 to 8 glasses of 8 ounces of water a day, veggies, fruit, fiber, and staying active, walking, doing whatever your usual exercise is to keep yourself moving. Now, some medicines make constipation worse, especially the anticholinergics. So be careful not to add another medicine in on top of narcotics that is known to cause constipation as well. Call your doctor if you're having problems. He might give you a strategy where you use laxative on nights that you have problems. May want milk and magnesia, may want a suppository, may want you to be seen. Also, make sure you deal with this problem and you don't end up in the ER with an impaction or something like that. It's a horrible situation. So get this problem taken care of. It is one of the ones you can influence the most. Nausea is a common transient problem. In other words, it doesn't stay with you. It's just with the starting of the narcotics or the change in therapy. So you usually can get through it and get over it. Doctors usually have a specific med. It's usually an antiemetic like Phenergan or Zofran. It might be an antihistamine that has anti-nausea side effects. Or like myself, I had ginger ordered for some of my patients that respond to herbal medicines. So find what the standing orders are, where to go, what pharmacist to talk to, and be ready to deal with nausea if it hits you during medication changeovers. Now let's talk about sexual problems. Sexual problems are something you really need to talk to your doctor before you get on narcotics, because narcotics or opiates decrease testosterone and therefore decrease libido in both men and women, decreasing your overall sex drive, and it can really influence the dynamics of your sexual physiology. So you need to discuss that with them. What can you do? What are the alternatives? Now let's also go over itching. Itching is another one of our transient problems usually. It's no allergy. Itching does not necessarily always mean allergy. It means in this circumstance usually that you are having a reaction to the new narcotic or the changeover. If you do see a rash though, it's a game changer, and get in touch with your pain care team. Itching is a common side effect for people beginning narcotics, especially when you jump up to a little higher dose. Usually antihistamines are what's used. Sedation is the last one. Sedation, pretty serious. You know, people go low and start slow on these narcotics, and they choose them very carefully. If you are having sedation, you may have too much medicine, or your metabolism may be changing, like your liver or kidney may be having problems. Something's not working right. So you need to get a hold of your doctor or your healthcare provider and get seen and maybe get some lab. Sedation is a serious issue. Well, that's it. I'm signing off. This is Dr. Kent from iChronicPain.com. I hope this helped you. I hope today's a better day. Take care.